Millions of Americans are now eligible to receive an updated COVID booster. The latest vaccines from Moderna and Pfizer are expected to be available at pharmacies and clinics around the country starting as early as today. Today. So for more on that, let's bring in Dr. Celine Gounder. She is the editor-at-large for public health at Kaiser Health News. She's also an infectious disease specialist and epidemiologist. Good to see you, Dr. Gounder.
Great to be here.
All right, so I've had 2 boosters.
And never had COVID.
Never had
He's
COVID.
A medical miracle.
I feel like, like for me, the boosters seem to have done the trick. What is different about this booster than the others?
So the boosters that are coming out now have been updated for the Omicron variant, in particular the BA.5 variant. That's the one that's most commonly circulating here in the United States. So the hope is that they might do a better job of protecting people. I think the most important thing to understand is that they are very safe, kind of like we update the flu shot every year. This update is very small and will not change the safety profile.
I want to follow up on that point because I have heard from a lot of people concern about the fact that they weren't tested on people. Explain to us what that means, and if people, you're saying it's very safe, how do you allay those fears?
The formula that's used to make the vaccine, everything is identical to the original recipe. The only change is in the mRNA, and that's a very tiny tweak. In terms of how it's been tested on mice. It's been tested on people in the sense that the original Omicron vaccine that was developed earlier this summer, so BA.1, that was tested on people. What we're seeing now is the BA.5 update. I think with the data that we have, we can say this is really, truly safe.
So if you have had COVID in recent months, should you get it? And I guess the question is, who should be getting the booster now it's available and who should not get it?
So first thing is, if you have been recently vaccinated or infected, had COVID recently, you do want to wait about 3 months before you get another vaccination. It's counterproductive to get that shot too soon, because if you still have antibodies floating around from that last booster or that last infection, that new booster won't take. Now, that said, if you are somebody who's 50 and up or you are immunocompromised, you are at higher risk for progression to severe COVID. I would say go ahead and get your updated booster now. Don't wait. For other people who are pretty low risk, and especially if you're already fully vaccinated and boosted, you may want to wait until closer to the holidays in order to have that maximal immunity at Thanksgiving, at Christmas, so that you're protecting those around you.
So let's dig deeper into this, because I know that there's a lot of people who got COVID over the summer or in the late spring. Should they get boosted now? Or is it better for them to wait? And the wait, if they're looking towards the holidays, if they're looking towards protecting other people or traveling, that's about 4 weeks out from their travel date. Is that right?
Yeah, so about 2 to 4 weeks out from their travel date is what I would recommend. If you're, again, low risk yourself for severe COVID, the idea here is really that you're trying to boost your protection against infection and transmission, importantly transmission, so that when you're around, say, older relatives, others who may be higher risk around holidays, you're much less likely to get infected and to get them sick.
Let's talk about sort of the PR battle that the CDC and the Biden administration is going to have to deal with. People who have received numerous vaccines and numerous boosters and maybe have even contracted COVID-19 are saying, look, enough is enough. I've had all these vaccines and yet I still got it. That science seemed to change is what people will say.
And they just feel like they're done.
They're kind of done with it. And so I guess the question would be, if in a few months, by the end of the year, if we track the number of people who have received vaccines, and the estimates are it's going to be low, that a lot of people are just vaxxed out, and we don't see the hospitalizations rise, we don't see the death rates rise, will these boosters be necessary? Because it does feel as if next summer we're going to hear, hey, there's another variant and here's another booster. But if you don't see people dying and going to the hospital by the end of the year, do we really need them?
I think it depends on who you are. So the CDC last week, before approving the updated boosters and recommending those, there was some debate. Do we do this just for people 50 and up, these updated boosters, or do we do it for everybody? And it's clearly a certain subset of the population that benefits most. I think where we're headed is a much stronger recommendation for people over 50, for people who are immunocompromised, have other underlying conditions, who are higher risk. And I think for the rest of the population, we're probably heading towards if you want one, you can get one.
More like the flu shot.
Right.
All right. Dr. Celine Gounder, thank you so much for coming here, and thank you for all that you do.